everyone, welcome to LifeStream Live with Angie. Today we are here with Lana Rimali, which is one of our options counselor, and she is going to talk with us about Medicare Part D because today is open enrollment for that. So, Lana, I'm going to go ahead and allow you to start talking about that. So, tell us about the open enrollment. Go ahead and take off with it.
I'll jump right in. Okay, thanks, Angie.
Yeah.
So open enrollment is, as she said, starts October 15th and runs through December 7th. That's every year, and we encourage folks every year to check their Part D plans that they have because the manufacturers change their formularies every year, and so it really is important to check to see if the plan that you have is the most financially beneficial for you. Sure. Which is a good thing. On average, I would say, just over the years, I've been doing this over 20 years, and on average, if people change their plans, they can usually save anywhere from $200 to $400 a year. And so, you may not think that sounds like a lot of money, but for a lot of our folks, that's a huge savings.
Sure.
It's important to take a look at that every year.
Right.
So how we got involved in this, let me go back, is that I'm a SHIP counselor, and that's SHIP, S-H-I-P, and that stands for Senior, of course I just forgot what it stands for.
That's
right. Senior Health Insurance Assistance Program. We leave out the A, but it's SHIP, and again, I've been doing that over 20 years. And so what we do with folks is when they come in, we take a look at their drug plans, we enter their medications, and then we pull it up and see what plan is most efficient for them.
Sure.
And that could be the same plan that they have, or it could be a different plan. Sure. A lot of times, again, you can save up to $200 to $400 a year if you change. There really hasn't been major changes in the Part D plans this year, except for insulin coverage. And certain insulins, a 30-day supply will only be $35. Which is a huge savings.
Sure.
But the thing with that is not all drug plans are participating in that program, and not all insulins are covered.
Gotcha.
So if you do the Part D sign up yourself online, there's a spot on there that says insulin coverage, and that'll tell you if a company is participating in that program or not.
Okay.
And so, again, it's important, I think, to get help. If you don't know how to do it, you can do it by yourself, but we've been doing this for several years, so we kind of know how to push and pull and do all the things that maybe not everybody, because you don't have to go through everything on the site.
Sure.
So we know kind of the shortcuts, I guess.
And I know, because I know many times, especially someone, though, that is just becoming eligible for the Medicare Part D, it can become quite scary because, because I know even for like my family, like for my parents, when they first became eligible, they didn't know where to start or how to even begin with it.
Right.
And so, because there are so many different types.
Right.
It's overwhelming for individuals.
Yeah, it can be. And the Medicare Part D is only one of the things that we do. And tying into that, if you're new to Medicare, then you're signing up new to Medicare, and then there's lots of choices with that.
Yeah.
Because you need Medicare, and then you have to have a Part D plan, or you get penalized for it if you don't. And then there's also Advantage plans that would take place of your Medicare. And that gets a little complicated. And then with a lot of Advantage plans, the drug program is already included. So it's a kind of an all-in-one package. But again, that may not be the best option for you.
Right.
And so it does get confusing. I had one of my friends that just signed up this year for Medicare, and it was amazing how much they got through the mail. Just 4 months before they turned Medicare. It's just like. And half of it, it's just, it's advertisement.
Sure, exactly.
But it's good to talk to somebody just to verify, what's going on out there. And at LifeStream, as SHIP counselors, we're independent people, so we don't have a stake in any drug plan or Advantage plan. Right. And so we might help you sign up for AARP or Mutual of Omaha, but we don't get any kickback from any of that. Which I think is nice because we don't have a stake. Our main goal is to do what's beneficial for the client.
Right, right.
And so I think I like that in the fact that, you know, we don't have a stake in it and we can be that independent voice of reason sometimes.
Sure, sure.
At least hopefully.
Right.
Yeah.
But we're not going to pick the plan for them,
Right.
but we're going to help them,
Right.
you know, as far as look at what plans and best options for the individual.
Right. Ultimately, it's their decision. I mean,
Yes.
I've had clients over the years that, you know, we've run their drug plan and they could save several $100s, and they just decide that they don't want to go through the hassle of changing, so they've kept their same plan, and that's fine. You know, that's their choice.
It works for them.
So, whatever they choose, we just give them the information, and then they take it from there.
Sure, exactly.
So, yeah.
Okay.
And then a couple other programs that when we're talking with somebody that comes in for a drug plan, there's some assistance programs out there through the state that you can sign up for. Some of those are through Social Security, and those are extra help, and that pays for more on your medications, and it pays your premium for the drug plan. And again, not all drug plans participate in that. There's certain plans, so we can help you navigate that. There are income guidelines for that. I could go over those if you wanted me to, but I mean, that's up to you. I mean,
It's whatever you feel comfortable
Okay.
going over, you know, I mean,
well, numbers sometimes people, I mean, I could tell
It
them,
can
but they may, you know, or they just may forget. But,
exactly.
But with extra help, the single people, if your income's less than 16, you can get help with that.
Right.
And then they also look at your assets.
Yes.
So your assets have to be under, like, right around $1,400. And you can sign up through Social Security. And so, again, it just depends on what they count as assets. There's a, you know, application, and we can help you with that process, or you can go online and do that yourself.
Sure, sure.
So yeah, it just depends. And then
Yeah.
there's also a Medicare savings program through Medicaid, and if your income is below 1988, you would qualify for that, and that would pay for your premiums, your deductibles, and your co-pays on your medications. So there are some programs out there that help.
Yeah,
So that is beneficial.
it's wonderful.
Yeah.
Good deal. Okay.
What do you have any? We do have some. This year, obviously, with COVID, it's
Yeah.
changed. We usually,
Yes.
obviously, it's 2020.
Right.
We usually do open enrollment sites.
Right.
I usually cover Jay and Randolph counties, so I'm usually at the Jay County Hospital several days out of the open enrollment period. But obviously, during COVID, we're not doing that, so we're doing all phone assessments this year. And then we also have some drive-through times that you can drive through and get a packet of information. You fill that out, send it to LifeStream. LifeStream will, one of us, an options
So-
counselor or a ship counselor, will call them then to do the Part D plans over the phone.
Okay. So when an individual, though, you know, is inquiring about, you know, the Medicare Part D, what all do they need to have ready when they are talking to someone about that?
Okay.
Um,
Yeah, they would need a list of their medications.
okay. And which I do have an example right here in which I can show you guys. You know, because it's always great, though, to have all your medications as far as, you know, if it is a 30-day or a 90-day medication, if it's a capsule, if it's a cream, a tablet, the dosage of it, the frequency, and, you know, as far as, you know, the medication name, if it's a generic, any type of information, you know, the more information you can give, the better, just so that
Yes.
way it can help with the plans.
Yes, for sure. And it does make a difference if it's a 90-day supply or 30-day, or if it's, you know, a medication that has, you know, a medication that's, what am I trying to, okay, I just lost my train of thought. I'm going to blame it on the cold.
It's one of those days
Yes,
today.
yes. So, yeah, I don't know what I was going to say. But anyway, it can make a big difference. If we're putting it in as, you know, a 30-day supply, it could be a lot cheaper if you get it by a 90-day supply.
Sure.
So it just depends. But yes,
Yeah.
all the information that you can give us is helpful.
Okay.
You know, and over the phone, we know that might be a little bit more challenging if we don't actually have a list of their meds in front of us.
Sure. Right.
But we know that you can spell, so we'll
Yep.
just take our time and
Exactly.
do it
Work
that way
through it.
if we have to. Because
Okay.
that's the biggest challenge is that, you know, pronouncing some of those names.
Oh, yeah, that can be a challenge.
Yes. So, yeah.
Okay. What other information would they need to have ready for you?
We would need their Medicare card in some instances, so that has their numbers and their effective dates on it. And then really, and then if you want help signing up for extra help or one of those programs, information about your income,
Okay.
things like that. So, and we will, if you do one of our drive-through, which you'll talk about here in a minute to get information, we will have all that information in the packet for you of what we need, and then you can just send that back into us. And like I said, one of the options or shift counselors will give you a call to get you, get you information on a Part D plan.
Okay.
So.
Okay. So, as Lana did mention, though, there are some drive-through events that are going to be happening, offered through LifeStream services. And those events, though, are happening in the Delaware County area at the Yorktown office, November 2nd, 16th, and the 30th from 11 a.m. to 1 p.m. In Madison County at the Pendleton office from 11 a.m. to 1 p.m. October 19th, November 2nd, November 16th, and November 30th. And the Wayne County at the Richmond office from 11 a.m. to 1 p.m. October 19th, November 2nd, 16th, and November 30th. So if you are needing some information and assistance for the Medicare Part D, this would be your opportunity to receive that assistance there.
And if you can't get to one of the drive-through events, you can just call LifeStream, and we will send a packet to you to fill out and send back to us. We encourage you not to wait until December to do this, because especially this year with sending in the information and then trying to get the information back to you, that's going to take a little bit more time.
Sure.
So again, you have till December 7th to change, but again, I wouldn't wait till then to give us a call to run your drug program, because there's no guarantee that, you'll get the information back in time to get it changed if you wait till the last minute. So.
Sure. So, but as far as open enrollment, though, it started today, October 15th. It rolls through December 7th. Coverage does begin January 1st.
Correct.
Is there anything else, Lana, that you would like to share?
Well, you can do this, like I said earlier, you can do this by yourself online, and it will ask you to either, you can create an account, or you don't have to create an account. If you create an account on the Medicare.gov website, then it'll save all your information in there.
Okay.
And then next year, if you come back again, you can access that account, and the medicines would already be in there.
Gotcha.
But we understand a lot of people don't want to put their information out there sometimes, so you don't have to do an account. We can do it without. We just don't have that saved in the system or on the Medicare.gov website.
Perfect. Okay.
So, like I said, you can do that, and it is possible to do yourself, but again, we've been doing this for a long time. It's just easier, I think, if you let us do it for you.
Sure.
So to save the headache.
And also, you get a friendly phone conversation out of it too.
Well, hope so.
Yeah, exactly. So, but we can also share though the Medicare.gov website, on after in the comments and everything, if you do choose to go that way. But otherwise, just call the number and connect with one of our option counselors and.
Yeah, and that number is
that way.
1-800-589-1121.
Perfect.
So,
Okay.
yep.
Right. Yeah.
And we'll have a friendly voice on the other end, or somebody will call you back. So.
That's right. Yeah. Okay. Well, thank you, Lana, for talking with us about the Medicare Part D.
No problem.
Is there anything else though that you would like to share today? Anything else going on in the option counselor world?
Oh, wow. Fast and
I know
furious.
you guys are busy. Yeah.
Yeah, COVID really has changed a lot for
I'm
us.
sure it
We're
has,
doing
yeah.
all of our assessments over the phone right now, which is, for a people person, that's kind of hard. 'Cause,
Oh yeah. Definitely.
You don't get that face to face with
Right.
the people, so we do miss that. But
Sure.
yeah, no, I LifeStream's a great organization. I said earlier, I've been here over 20 years, and I believe in what we're doing, and this is just one of those outreaches that I'm kind of passionate about.
Sure.
So, like I said, anytime we can save our folks that we deal with money, that's a win in
Perfect.
my book.
Yeah.
So, just even if you've not seen us before, give us a call. Let us help you out.
Okay. All All right, perfect. Well, thank you again, though, for your time,
Not a
and
problem.
congratulations for 20 years. We definitely appreciate your dedication to LifeStream.
Yep.
Yeah.
Well,
so
like I said, it's a great place to work.
Definitely, it is. So, but what is going on in LifeStream world? As far as other programs, I will share with you some things though that we do have. We do got our curbside services for other counties. If you do know of someone that is 60 or better that could benefit from curbside services, you can contact our office to see if those services are offered in your county. Reminder, LifeStream covers 12 counties. Not every county has the same services. They vary. So you can give us a call and see what services are offered in your county. We also have our Friendly Caller program. We are always looking for volunteers for those services. Is what that consists of is calling an individual that is homebound, that needs a friendly phone conversation once a week. It's a rewarding program. You get to lift the spirits of an individual that is needing just someone to speak with, and just bring some sunshine in their life. So if you know of someone that is 18 years of age or older and that is interested in becoming a volunteer, they can contact our office and speak with our volunteer service administrator, Laura Bray, and connect with that program. We also have our senior safety net food distribution services for individuals 60 years of age or better. Again, these here are offered in different locations of the areas that we service. So if you know of someone that could benefit from the senior safety net food distribution, contact our office for that. Dementia Friends. If you know of someone that is interested in becoming a dementia friend and joining this program, connect them with our office. Lana, are you a dementia friend?
I am.
Perfect.
I am.
Great. So it's definitely a great program. We have a support group, and we are always looking for individuals and organizations to become dementia friends. So help spread the word about this. Whoops, I got papers flying around.
Little windy.
Yep, exactly. We also have November is our caregiver month. It's the National Caregiver Month, and so this year LifeStream will be acknowledging and recognizing caregivers by offering a drive-through event. And so the first one coming up will be at the Minnetrista parking lot on let me get my paperwork here. I apologize for that. On Wednesday, November 4th from 11 a.m. to noon. And this is while supplies last, but caregivers will be driving through, and they will receive a mini loaf of pumpkin bread, some hot cider, and some caregiver resources. And just a thank you to the caregivers for being a dedicated caregiver, and just providing the services that you do. And like I said, though, we will have each week for the first 3 weeks, we will be providing those drive-through events in different locations throughout different counties. So I will be announcing those throughout the weeks as we go. And then lastly is, as we are nearing toward the holidays, is our Angel Wish, which is a big event for us. So it's looking a little different this year because of COVID, as we always say. But it's still going to go on. And but if you are interested in helping us provide this service this year, we are looking for monetary donations of just a $25 donation. And with that donation can allow us to provide a $25 gift set to an individual. Or you can sign up to become a delivery elf, which could be a lot of fun, very rewarding.
Yes, it is.
Or become a sponsor of this. So if you are interested in one of these options here, you can contact our office. Again, Laura Bray, which is our volunteer service administrator. She is over this event, and you can connect with her to find out how you can help us out with this. So anytime you are interested in helping LifeStream services, and we have a friend in the background, so I apologize for the distraction here. But anything, though, that you are interested in helping LifeStream out with, contact our office and we'll be more than happy to assist you. So, Lana, again, thank you for coming out and joining
You're welcome.
me on this dreary weather here. So, thank you, everybody. Stay warm, stay safe, and we will see you next week.
Thank you.